Looking now at our part 2 of our section on female endocrine. And like we've said a couple of times, there are a lot of ways you can break this down. You could do each of the conditions as their own sections, but kind of from trying it that way, what we find is there's a lot of overlap, a lot that we can say that is similar. And so it does seem to make more sense to group them. And how I've chosen to group them is in terms of patterns of excess, which we saw in our last video, and patterns of deficiency, which we're going to see in this section. Now here we're going to talk mostly about secondary amenorrhea, or long periods, or increasingly long periods. We're going to see a lot of light periods, things like that. And we're also going to talk about menopause. Now you might say like, well, those are not the same. They're not, of course, but they do have some commonalities. We'll get into some of the things that are the same and some of the things that we do that are different in terms of treatment. Even before we get into this, actually, one of the most important things to say is that although we spent a lot of time talking about the excess patterns, so those PCOS, endometriosis, fibroids, and that would include some other things as well. Here, there's actually less to say. When you've got a deficiency pattern, there's less to say botanically is maybe the better thing to say there. When you've got a deficiency pattern, your first treatment principle is really very straightforward. You have to correct the deficiency. You have to build up what has become deficient. Now, in secondary amenorrhea, usually that's going to be blood. And when we say blood here, we don't have to do that sort of complex, well, it's not that complex, but that TCM understanding of blood. Sometimes this is just straight anemia. Conventionally, we know that the most common cause of secondary amenorrhea is often either due to anorexia, excessive exercise, blood loss, things like that. As we said in our last video, there is always a reason a woman who is in that age range doesn't make a cycle. So if a woman isn't having her period, we need to find out why. And we usually can. So in this case that we're looking at, let's get into it a little bit. We see, and it's not meant to be a leading case, but pretty quickly, especially since, as students, you're honed to read a case and be like, aha, oh, I know what's happening here. So this isn't meant to do that, but you'll see in there some of the very common things that we see that leads to deficiencies. And I'll probably add one more as we go as well. It might be a little controversial. We've got 28-year-old woman. You could bump this up or down a little bit, but 28 seems to be kind of almost a magic number where things start to change. Metabolism starts to change. The little cracks that have maybe been building up over time have started to show and have started to have actual physiological outcomes. And this is what we've talked about so many times, and I mentioned, I think in our last videos, something that I'm really interested in is physiological compensations start to become, if not pathological progressions, at least things that we can give a condition name to. So we might have gone from, my periods have always been light, a little bit scanty. We see some of that to, the cycles are starting to get longer and longer, to, I haven't had a period in 3 months. And that's where we say, okay, you now meet, I don't exactly know how many months you have to not have a period for, but you are now meeting or getting close to the criteria for secondary amenorrhea. You now have a condition we can name. Where we do, I think, our best work is before that, where you don't have a condition we can name yet, but we see signs that suggest, okay, this is the track that we're on. Let's make what adjustments. Let's do what we can back here to keep you from going down that path. And if you feel like, you say that all the time, I say that all the time. I say that all the time because I see that all the time. And in practice, so much, and they say this of just about anyone who works with patients over time, is that the longer you practice, the less you prescribe, the more you realize, oh, here's what you really need to do. And these cases are as good as it gets for examples of, here's what you really need to do. You've got to eat better. And you've got to give your body the things that it needs. You've got to give your body the nutrition that it needs. And you know what? You've got to sleep more. You've got to sleep better. That's sometimes harder. We talked about that in our insomnia lecture. But you've got to work on improving the quality of your rest. You know what else you need? Physical activity. You know what else you need? You got to work on how you handle and process stress and all of those things. Sometimes I think of those 4 things really as the pillars, the table legs of good health, whatever you want to call it. But they effectively become non-negotiables. And often in our patterns here, where we see, I'm going to continue to use the word secondary amenorrhea, but really just think of it as like missed cycles or cycles that are long. Often we have, a period only occurs every other cycle, but I'm going to generally call it secondary amenorrhea. Don't get too hung up on the label there. But in terms of that table, those table legs of health, often here it's that nutrition piece that's missing. Now, of course, it could be over physical activity. We'll see some of this in just a second, but it's often that nutrition piece. I would say 8 times out of 10, when we see a case that presents like this, it's a lack of protein and fat. And often it's that simple. So you can add some botanicals, and we'll talk about some carminatives, optimizing digestion, etc. But often it's that simple. Okay, let's talk about your protein intake. All right, let's track it. Let's get some real numbers on the case here, and we just find it's been insufficient over time. And that's the reason, almost certainly, that's the reason the body stopped making a period, because it doesn't believe it has access to the resources to carry a term pregnancy. That's what a woman's body wants to do. It doesn't have to be what her mind wants to do. And I have this discussion with patients, and I always have it with a smile. But remembering that physiology is geared that way. It's important that it's geared that way. And so if it's not that way, there's going to be a reason. Even if the woman doesn't want to have kids, which is absolutely, of course, fine. So that's no problem. But her body should still be able to produce, to achieve, maintain, and sustain, of course, deliver a child. Often, one of the only reasons, no, that's not true. I'll take that phrase back. One of the main reasons a woman's body would perceive it can't do that is a lack of nutrition, a lack of resources to do so. So we've got a 28-year-old woman here, absence of menses for the last 3 months. Give or take. I've certainly seen longer. And I'm going to go through the list of it's not this, it's not this, it's not this, because you have to do that. Not pregnant. Okay. That's usually pretty easy to confirm. Lab imaging results rule out cancers, endocrine etiologies. So these are obviously the much more challenging and certainly much more ominous conditions that we could see, cancers, other endocrine patterns, and these really take us down a different route entirely. Most of what we see, so I said a moment ago, 8 of 10, maybe even more, are completely amenable to treatment, and usually we can bring back the period once we get things in balance. The other set, probably is less than 2 of 10. It's probably, maybe even less than 1 of 10 is where we actually have something else going on. Not in my practice, I don't see a lot of cancer, but those usually go somewhere else. And if a woman goes to the conventional system and says, I haven't had a period in 3 months, usually that activates an algorithm that does get a series of tests and imaging done. So what we're saying in these cases, and for our case today, is it's not that. So don't be fooled like, oh, what if it's this? This is what we're saying. It's not. It's not that. So not cancer, not endocrine. Patient is not anorexic. She's not training. Actually, this one we do see fairly often. So exercise excessively. A lot of people, a lot of women train for marathons. And I think it's great for people to do that and to challenge themselves. I would probably stick to saying most human bodies are not built to run marathons. And it's fine. I get the psychology of why people want to do it. But it's not. Don't think of training for a marathon as a healthy thing. It's generally not. It's putting your body into a deficient state. It's demanding something from most people's bodies, as men and women, that is really not built to deliver. And the damage someone is doing to their joints, hips, knees, ankles, maybe irreparable. So I'm not pro marathon training. I'm not even really pro triathlon, though that's a little better. Now, I'm not saying people should never do it. Obviously, people like it. But excessive, I'm going to use the word excessive, physical activity comes at a cost. Now, if you've watched any of these videos, or if you've listened to the podcasts that I do, or if you've been in classes that I teach, I talk about physical activity all the time. I'm always promoting, do more physical activity, get to the point of being uncomfortable. So, and that's really important. But we've got this. We've got the area where here is the comfort zone. Change doesn't happen in the comfort zone. Change only happens in the growth zone. That's what we want. This could be physical activity, personal growth and development. This could be any number of things here, but this is a growth zone. We want to be in here. Beyond the growth zone is the trauma zone. And that's true emotionally. It's also very true strictly physically. I would suggest for most people's bodies, marathon running occurs in the trauma zone. And that's why we have to mention excessive exercise as a cause of secondary amenorrhea. And that's a real thing, right? If a woman's period stops, that's the body saying, yeah, things are so bad that holding a pregnancy is no longer a great option. So let's just shut this system down. Let's shunt resources over to what the demand is, to where the demand is, and then we'll get back to the business of reproduction once things are safe. A lot to say in there. There's a lot of psychology in there. I don't want to really get into it too much, but there's lots to get into there. So we've also, we're ruling out GI bleeds. We're saying, there's no hidden blood loss or anything like that. Hemoglobin, ferritin, B12 are all slightly below normal range, or I'd even say like low normal. That's often clinically, that's more where we see them is in the low normal range. What does that mean? So iron, so let's say our ferritin, that probably means a ferritin of certainly less than 30, but truthfully probably less than 15. And usually that's going to be a 12 of less than 300. Those are the numbers, give or take, whatever, lots of room for discussion there, but those are numbers that start to signal to me like, okay, something's happening here. Either intake of food, and often that's going to be due to a lack of intake of animal products. And if you don't like that on an emotional or spiritual level, that's fine. That's no problem. I don't ever force anyone into doing anything they don't want to do, of course. But our body needs certain base amounts of iron, B12, protein, and fat. And you can get them however you want, but often when we see if digestion and absorption is okay, we have to look at intake. And if intake is okay, then we have to look at uptake, and that's where we talk about some of the optimizing of digestion. I'm going to avoid that discussion. It's a discussion I have, that vegan-vegetarian dilemma is a discussion I have in clinic many times a week. It's incredibly popular right now to move to a plant-based diet, and that's fine, of course. For most people's bodies, most people's body types, that comes at consequences to health. And if that makes you emotionally angry, I'm sorry. That's just how it is. One of the biggest challenges, I've said this before, it's one of my favorite quotes, emotion and logic have never sat down at the same table and both left satisfied. And one of the big challenges right now is a lot of things we become emotionally attached to add a consequence to logical discussion, or in this case, in our case here, as a consequence to physiological challenges. Works very well for some people. Doesn't for others. Said I wasn't going to go into it, and then I went into it. Couldn't resist. Okay, our patient here is pale, thin but not gaunt. So, not looking anorexic-like, but also you look at them and you're like, okay, you're thin and generally weak. Now, that thin part, though, that doesn't have to happen. We can definitely have people who are actually pale and still appear generally weak, and yet they have some excess weight. They look soft, doughy. I don't know if we're still allowed to use the word chubby, but that's kind of the word that comes to mind as an image, because it is that kind of like, there's no resistance here. It's soft. And that is the same idea of someone who is weak but is carrying extra weight, and that we often see that, truthfully. That's probably even more common as the presentation. Complaints of significant fatigue. Yep, low mood, low libido, low energy, low socializing. Not so much low socializing, but often because of these other things being low, there's less of a drive to socialize. Maintains employment, so we're not saying someone who's driven all the way to more of a chronic fatigue pattern or where they can't work can do it, but just feels tired all the time. We'll see this almost without fail. If a woman is at the place of her menstrual cycle has shut down, her fatigue is such that she's really struggling. She's really struggling to get through day to day, week to week. Often these patients will say, I can't sleep enough. I'm tired all the time. I think we'll see that in just a second. Falls asleep easily, but the sleep is, I would even say not so much restless, but light and easily disturbed. Of course, we're describing some of the hallmarks of a blood deficiency pattern there, but that's very common in practice. Even if you don't know anything about TCM, this is usually how these patients will say, I fall asleep, I lay down, I just have 5 minutes of not doing anything, and I'm out. I fall asleep. But when I go to bed at night, I'll sleep 8 hours, I'll sleep 9 hours, but I won't wake feeling refreshed. My sleep will be light, I toss and turn, I hear all the noises. If my partner moves in bed, I wake up. We get that light sleeping pattern. Falls back asleep usually pretty easily. Bowel movements regularly loose, sometimes undigested food. We see that. Significant bloating after meals, same thing. Feeling dizzy when standing. Yep. and often an increasing anxiety. Several reasons here. I know we've done a session on anxiety as well, and we talked about blood deficiency as one of the main reasons for anxiety, so you can go back and look at some of that. But if this feels like it's overdone, if it feels like, oh, this character, you've added every single thing in there, yeah, I have. Often, if we get to the place of secondary amenorrhea, almost all of this is in there. Obviously, it doesn't have to be everyone every time, but you'll find most of this in there when we do see patterns of secondary amenorrhea. Okay, we'll get into our TCM integration here. And I don't think you're going to, this one's not too complicated or too long. And I don't think you're going to find any surprises because it's, in a lot of ways, it's what we've just spoken about. And in a lot of ways, it's kind of the same thing as, conventional physiology. When the body moves into a deficient state, call it anemia, call it other things, we see these as a result. Pretty much always we're looking at, I'll actually underline blood first, because usually it almost has to be this, but we're going to have a Qi deficiency for sure. The liver and the heart are the main organs involved. The liver, of course, this is going to be liver blood, and so we would say insufficient liver blood to produce menses. And we see that pretty often. We could also have it as a spleen failing to build Qi in blood. There we go. We've got spleen Qi deficiency progressing. That can be either from intake again or uptake. So that can be the cause of the blood. So we're saying blood deficiency is the main thing. We're saying there's a lack of period because of insufficient liver blood to produce the menses, but that can be from a spleen Qi that creates that blood deficiency. Or it can be from anything that creates a blood deficiency. Yep, so we've got occasional undigested food, lowered libido. This tells us Qi deficiency is producing into a Yang deficiency. Almost always we see this. Now we mentioned in our excess pattern, really this pattern as a way of getting an excess pattern from a deficiency. As Qi and Yang deplete, then the liver doesn't have the ability to do its jobs. It doesn't have the resources, and therefore we get a stagnation from that deficiency. Here we're not necessarily saying that. Here we don't even need stagnation in this case. In fact, there might not be any. There might be some. That's obviously fine. But here we're much more likely, I actually didn't describe it up there, but we're much more likely here to see the menses as scanty, light, and short duration. So usually that's going to be 1 to 3 days of light flow. That would be the most common thing that we see here, where it's a woman who says, yeah, I still get it every cycle, but it's short, it's light, doesn't last very long. Or they say, I only get it every other cycle, and then they describe the same thing. Or they haven't had it for 3 cycles, and we say, well, what was it like when it came? And it was like this. So we can see clots, of course, if we do that, it says stagnation, but we don't usually see clots in an uncomplicated version of this pattern. So that's our kind of take on secondary amenorrhea, mostly related to a blood deficiency, but we've got outcomes because of that, and we've got causes underneath that. Menopause, switching topics a little bit. Of course, menopause is a amenorrhea, or at least it becomes one, is best viewed as a yin deficiency, though here it doesn't mean that the woman's done anything. This is a natural progression, and this is not necessarily blood deficiency at all. Blood could be fine, but we've got a decline in Jing. Kidney yin naturally wanes, fails to nourish the heart yin. Kidney and heart yin deficiency, which is really the diagnosis for menopause. There could be any other number of things going on, of course, but menopause is often considered empty heat. That's, of course, the hot flashes that we see there. So the treatment will be a little bit different here because up top, we're going to, of course, focus on, so here, treatment principle is build blood, whatever that means, and Qi. And here our treatment principle is, we could say nourish. I'm moving kind of away from the word nourish towards the word tone. I'm even kind of dropping the word tonify. I just like the word tone, but those are just semantics, doesn't matter. Nourish or tone, yin. And we can do that certainly with some of our herbs. Up here, this one is probably the best in terms of yin. So the more present the hot flashes, the more likely I am to use Romagna, but I do pair it with other things. Okay, in this section, let's actually talk about our outcomes and our actions, and then we'll talk about the formula in our next section. We've got a fairly large formula today. Our actions, as always, are pretty straightforward. Our outcomes are pretty straightforward. We want to reinstate regular menstrual flow. Actually, I wrote it in here, except of course in menopause. Although I shouldn't say almost always. Often in menopause, when a woman comes in and says, "Yeah, I think I'm, perimenopausal. I'm starting to see changes in my cycle. Can we do something about it?" And we do a formula like what we see today. Often the period comes back, and that's usually a good thing. It's usually a good thing in that it seems to make the transition smoother. It's kind of like, let's give the cycle the energy and the resources it needs to produce a few more, and then it tends to, rather than be more sporadic and intermittent over a longer period of time, we tend to see smooth and then actually mostly just a drop off. But I've certainly seen it clinically where we've done some of these things and a woman's cycle comes back and it's actually regular for 3-4 more months, and then it switches again from there. And of course, we want to resolve any co-presenting symptoms, which we saw quite a few above, especially digestive. Why especially digestive? Because this needs to be in order if we want to build blood and chi. You've got to have that operating well. Our actions, adaptogen. Yep. So if we were to say, I do this bit often in class where I say, when we look at deficiency patterns and excess patterns, and we look at our broad overarching categories of botanicals, which largely almost all botanicals fall into one of three very large categories: adaptogens, alternatives, and antimicrobials. And almost every other action could really feasibly be looked at as a subcategory of these actions. So setting antimicrobials aside, because those obviously are quite specific, we look at adaptogens and alternatives. And sometimes you've probably even seen me do this bit where I say, wherever there's deficiency, one of the best things you can do, and this doesn't have to be complicated, you barely even need an understanding of TCM at all to understand the concept of excess and deficiency. Because most of the time, I say this, we spend a lot of time talking about how to differentiate them. Most of the time, when you look at a person, even if you know nothing about physiology and medicine, we can just tell, right? Like we can all think of that friend or person we know or family member who you're like, whoa, yeah, you're deficient. And often I use this as an example. Let's say you had to move. You needed some help moving. The friend that you would not ask, you're like, oh no, I'm probably not going to ask Susan, because it would be a struggle because that person is weak and deficient. That's kind of our caricature. No offense if your name is Susan. That's kind of our caricature of a person who's deficiency. And on the other side, if you think of someone, you're like, oh, that person is angry. That's more of an excess pattern. And often we see that if you think deficiency, you think pale, weak, just looks like they're not going to be very strong. Looks like they're not who you want to help you carry a couch up a flight of stairs. If you think of excess, they're like, okay, a redder face or redder complexion, more vibrant, but also not who you want to get into an emotional discussion with. So you go from there. When we talk about those two as broad categories, so as I was saying, you can often tell those people apart fairly easily in practice, and it's really as simple as this. Deficiency, use adaptogens, build up. Excess, use alternatives, clear, move, release, relieve. Starting there, in a lot of ways, is half or more of really what you need to do. If you know some good alternatives, hepatics and a few of the diuretics, and you know some good adaptogens, qi and yang, you probably got most of what you need to do. Throw in some good antimicrobials. Congratulations, you're now a herbalist. So you're asking yourself, well, why have I spent so many hours watching these videos? Well, that's because that's what you got to do. That's what you need to learn. But I do always favor keep it simple. Now you're saying, well, okay, you're talking about deficiency, but then you've made alternative one of your secondary actions. Yep, I have. Why? Because where things are not moving efficiently, there's going to be some waste and some byproduct. And that's kind of that same idea of you can still get an excess from a deficiency, and so you still want to use herbs or other things that help move things along, clear that excess. So you think of adaptogens, build up, alteratives, move things along. And we'll want to have some element of both in our formula here, but mostly we're looking at adaptogen. And like we talked about, botanically, we're not limited. There's lots we can do botanically here, but often the biggest work you're going to do here is going to be outside of herbs. Okay, let's look into carminative and demulcent. Why are these in here? If digestion and absorption is the primary reason why someone's not building that qi in blood, not absorbing, getting the micro and macro nutrition that they need, you've got to help them do that. So if intake is fine, we need to optimize uptake. Same thing with demulcent. Often we have, that's not supposed to be crossed out, often we have inflammation in the gut. We haven't even really talked about that, but that can be a really key thing. Inflammation in the gut / food sensitivities. This can be a major reason. And this one we kind of don't have, and we can, but this one we don't really have that TCM equivalent. I mean, we can find it, but it isn't quite as naturally graphed on here, where we say, okay, you're not absorbing because you're having a food or sets of foods that are causing irritation, inflammation in your gut, and therefore those villi can't take in the nutrition. So often, if intake is fine, this is the next place we look. Now we can still say, well, that's spleen failing to build qi in blood, and then we can say due to a pathogenic factor causing injury, whatever. Drop it when it makes most sense to. And food sensitivities are a big area where we talk about blood deficiency or lack of absorption. Okay, let's wrap up our first video there, and we'll come back and look at the formula, and we'll start to look at some of the herbs we're going to use in this section.